Good morning, good afternoon, and good evening, everyone. On behalf of UNICEF, I would like to welcome you to this webinar on the launch of the UNICEF Global Database on Children in Residential Care. Before going into the actual webinar, I would like to let you know that interpretation services are available for you today in French and Spanish. If you wish to use the interpretation services, please click on the globe that can be found at the bottom of your screen and select the language that you wish to have interpretation on. So my name is Claudia Cappa, and I'm a senior advisor on statistics and monitoring in the data and analytics section of UNICEF in New York. I've been working in the area of child protection for almost 20 years now, focusing on various child protection topics, including children in residential care. Today, I have the great pleasure of being joined by two colleagues from UNICEF. First of all, Nicole Petrosky. Nicole is the statistics and monitoring specialist, also in the data and analytics section of UNICEF New York, and she has been working in the field of child protection for several years. We are also joined today by Aniruddha Kulkarni. Annie is a child protection specialist in the child protection section of UNICEF, also in New York, and he will share with us the implication of the data that we will present today from the point of view of programs and advocacy. Without further ado, I would like now to give the floor to Nicole Petrosky, who will share with you the content of the webinar.
Thank you so much, Claudia. And welcome, everyone. It's great to be here with you today to present to you the work that we've been doing over the past several years to build a global database on children in residential care. So first of all, let's talk a little bit about what we consider as children in residential care and how we define children that are in residential care. So we apply the definition that's outlined as part of the UN guidelines for the alternative care of children. And the official definition that is contained in the guidelines is residential care includes care provided in any non-family based group setting, such as places of safety for emergency care, transit centers in emergency situations, and all other short and long-term residential care facilities, including group homes. So we consider children living in what would maybe traditionally be considered or referred to as orphanages as being children in residential care. We also consider children in, for instance, contexts like small group homes to be children that are living in residential care. One of the key elements of classifying children as being in a residential care setting is that, again, this is a non-family based group setting. So it's a type of alternative care. So care for children who are living outside of their family and don't have a family to live in. And they're living in a group setting that is not a family type, family based setting. We, however, do acknowledge that there can be variations, of course, across countries for what is considered as residential care. And so you'll see when we talk a little bit more about the content of the database that we have developed, there's some variation in the exact types of residential care that are covered across the countries. So we allow sort of some variation in this definition for countries to apply their sort of local knowledge and understanding in determining what types of service models would be providing residential care services in their country. So for instance, in some countries, boarding schools might provide what's considered to be residential care, or for instance, religious places like monasteries, for instance, might be really considered as a type of residential care. So there's some variation across countries in the exact type of service models that are reflected in the numbers that we have for the number of children in residential care. So what data are included in our database? So what we provide as part of the database, which is available on our website, data.unicef.org, you can find an Excel version of the database that is now available. It can be downloaded. We've also loaded all of the data into our data warehouse. So you can also query the data and find the data that way, and have updated our thematic page on children and alternative care. And I'll put the link to, I'll put the relevant link in the chat box in a little bit. So this database, it includes the latest available country data points. So the latest data point that we could identify and verify as the latest for countries. And these are reflected as the rates per 100,000. So it's the rate of children in residential care per 100,000 population. For each country level figure, we also include the reference year. So this is the year to which the data are referring. So for instance, is it a 2020 figure? Does it refer to the number of children in residential care in 2010? So we include that level of detail as part of the database. We also include the reference age group. So in most cases for this particular indicator, this is reflecting children being those under the age of 18 who are in residential care. So it covers most of the figures, country level figures cover the entire population of children under the age of 18 that are living in residential care. But in some cases, some countries may have a more narrow their data may refer to a more narrow age range, and in that case, we always footnote it accordingly. And we also include information about the data source, which is really important. So we only include official statistics and data that are produced by official sources as part of our global database, and we'll talk a little bit more about that later. In the current version of the database, we have identified 125 countries that have data with a data point between the years of 2010 and 2021. Now, this doesn't mean that there might be, for instance, data for a country prior to 2010, but we are not publishing these as part of the public available database. So what you'll find in the database is only countries for which we've been able to identify and verify a data point between the years 2010 and 2021. And one of the reasons for applying that more narrow year range is because we know that in the case of residential care, it's an indicator, and the numbers that can fluctuate quite substantially over time and even annually, because we have children coming into the population, we have children leaving residential care, so the numbers can change quite often, and that's why it's really important to have as much as possible to have the most recent data point we can get for every country, so that it really reflects the current state of residential care in countries. And of course, with having COVID and stuff recently, this becomes even more important, because we know that there was changes in the population of children living in residential care over the last few years in many countries, as the COVID pandemic spread and children were, for instance, leaving residential care facilities and being returned to their homes because of course, fear of having, many children together in one place. So again, a big reason why it's important that we have as recent as possible figures for each country. We also have calculated and included as part of the database global and regional estimates, which is what we'll be sharing with you today. So where do these data come from? What types of data sources do we rely on? So for most countries, we are primarily relying on administrative records. So these are records that are maintained by government ministries who are usually mandated to oversee the alternative care system in a country. So they have various names. It varies across countries in terms of the exact name of the ministry. For instance, sometimes they're called ministries of child welfare. Sometimes they can be called ministries of, family, or ministries of social affairs. But the important point here is that the data reflect, in the most cases, for most countries, the data are reflecting administrative records. So these are, produced by the administrative system in a country, and it's a record, it's a number of the children that are in alternative care, in residential care specifically. In some cases, and for some countries, we have identified data points based on websites or reports that are produced or maintained by the national statistical authorities in a country. So in some cases, we were able to identify a data point directly by, for instance, the National Statistical Office. And in some cases, and this particularly applies more in the case of high income countries, which again, I'll come back to this point in a little bit. So how did we compile this data into the global database? Well, we primarily rely on an annual exercise that takes place in UNICEF called the Country Reporting and Validation Exercise, or what we very lovingly refer to as CRAVE. So this is an annual exercise that takes place in UNICEF to update our global databases across a number of sectors. So it's not specific just to the indicator on children in residential care, but it's also an exercise that we undertake to update, for instance, our global databases on health and education, et cetera. And also in a number of other areas of child protection as well, beyond just children in residential care. So the purpose of this exercise is really twofold. The first is for us to give our country offices an opportunity to review and validate the existing data point we have in the database and the corresponding data source. So it's an opportunity for the countries to see what is the latest data point and data source that we have reflected in the global database. And then, of course, secondly, it's an opportunity for our country offices to let us know if there's any new or updated national level data points and data sources that should be considered for inclusion in the global database. And this process, this mechanism of CRAVE, it takes place through extensive consultations with our network of country offices. In most offices, there's a designated focal point who is responsible for participating in the CRAVE exercise every year. Typically, this is someone who fulfills an M&E function in the country office. And we receive those submissions, we receive those updated or new data points and data sources through an online platform at HQ. And then those submissions are reviewed by the relevant technical specialists at headquarters based on a number of predefined criteria, which I'll talk about in a little bit. One really key point that we want to mention here is that, again, this process of CRAVE, it relies on our network of country offices, and these are offices where UNICEF has a program presence. So we don't have currently in place a similar mechanism or platform for engaging with high-income countries to identify and update data points and data sources. These are primarily high-income countries in Western Europe and North America. So sometimes what we will do, and as we did in the case of children in residential care, we might undertake a separate dedicated data compilation exercise to try and identify the latest available data points, particularly for these types of countries that fall outside the scope of the CRAVE exercise. And in the case of children in residential care, we did undertake this targeted type of data compilation exercise between 2012 and 2017. And again, this was mainly as a way for us to help identify data points for high-income countries that would not be reached through our standard CRAVE exercise. One implication of this is that for these countries, in these regions specifically, the data points that are currently in the database may be slightly outdated. So it is possible, again, especially for these high-income countries in Western Europe and North America, that there might be a more recent data point that we are simply not aware of, because again, these countries don't regularly take part in the annual CRAVE exercise that we do with our country offices, and we have to do a separate, outside of the scope of CRAVE, we have to do a separate targeted outreach to those countries to identify data sources. So what criteria do we use to evaluate the data and to consider it for inclusion in our global database? So the country must submit to us a number count of children in residential care settings. Sorry. So we ask our countries to provide us with the number of children that are in residential care settings, and then we on our end, on HQ side, we convert that into a rate, and I'm going to talk about how we do that and the method that we follow to calculate the country rates. We also request that we know what the reference year is. So this is really important for us in order to be able to calculate the rates accurately, because we use population figures in calculating the rates. So we need to understand the year to which the number that the country has provided us, the year that that's referring to. So we need to understand, is that the number of children in residential care in 2020, or is it the number of children in residential care in 2021? So we ask that they provide the reference year for the data. Also really important is that we require that the data be produced by an official source. So again, typically for this indicator, most countries, their data source is the administrative records that are maintained by the relevant line ministry or the National Statistical Office. So we do require that the data points we include in the database, these are official sources. They're not, for instance, a survey or something that's been a mapping or something that's been undertaken outside the scope of the official statistics produced by the country. For our global database, because we do use it for the purposes of global monitoring and reporting on children in residential care, the data points must be representative at the national level. So we don't include subnational data points as part of the global database. So we need to have a figure that's representative of the entire country. And another key point is that we require that the data source be verifiable. So we do require our countries, when they participate in CRAVE, to submit to us supporting documentation that we can then review as part of our assessment. So this can sometimes be in the form of, for instance, like a website link to the line ministry, or maybe there's a dashboard or a database that's maintained on the website, or there's sometimes it could be a report that was put out with the figures. So some sort of written record that we can maintain and keep that includes, the data point that's been provided, information about the year, and what is the source of the data. Now, as I was mentioning at the start, there is some variation, for instance, in the definition of children in residential care across countries. So we do consider including data points from countries if there's some variation from what we consider to be our standard indicator definition. And in cases where a country's figure might differ in some important way, either because the definition is very different or the age group is maybe only referring to a more narrow age range of children, we always include a relevant footnote about that as part of the database. So you will see when you go and have a chance to take a look at the database, there will be some footnotes for some countries to provide this additional level of detail. So how do we calculate the country rates? So the country rates are what you're going to find when you go and look in the database. So you're not going to find, for each country, you're not going to find the number of children in residential care. What you're going to find is the rate that we have calculated based on the number of children in residential care that's been reported to us as being the latest official number of children in residential care. And we use that number in conjunction with standard population estimates that are produced by the UN Population Division. So this is a way of standardizing the population figures. So instead of relying, for instance, on a country's census or their own, population projections, we use standard population estimates that are generated by the UN Population Division. And the formula, the way that we calculate the country rates, you can see the formula here at the bottom. It's fairly simple. We take the number of children in residential care, so that's the number that's reported to us as being the number of children in residential care. We divide this by the number of children in the population. We multiply it by 100,000, and this is how we get the rate of children in residential care per 100,000. And those are the rates that you will find in the database. Now, an important thing to mention here is that and I was alluding to it earlier, is that for each country, we customize the population figures so that the figures for each country match the reference year of the reported figure. And that's why it's so important for us to understand the reference year of the data point that we receive. So for instance, if a country submits to us a figure and they tell us that this is a figure for the number of children in residential care in 2010, we then use the population of children in that country in 2010 to calculate the rate. So in essence, every sort of country has its own sort of customized calculation for the country rate. So how are our global and regional estimates calculated? So both of these sets of estimates are population weighted estimates. The world aggregate is a weighted average of all the UNICEF subregions that make up the world. So we have like 9 subregions. We take a weighted average of those regional averages to get the global average. And we take this approach instead of, for instance, taking a weighted average of available country data. So we take an average of the subregions rather than of all the countries with data. And then the regional aggregates are weighted averages of all of the countries within the region. So within each region, we take a weighted average of the countries within that region. And important to mention here is that you'll only find in the global database and in the published figures regional aggregates when at least we reach a threshold of at least 50% of the regional population covered by the available data. So we do not publish a regional aggregate if the available data that we have for countries in that region falls below that 50% threshold. And again, as I was mentioning before, the global database currently includes the latest available country data within the year range 2010 to 2021. So the global and regional estimates also reflect, in a way, that year range. So it's countries that have data within that year range. So how do we treat countries with missing data or countries where we haven't been able to identify a data point? So when data for a country are entirely missing or not available, we don't publish any country level estimates. So in the database, you will see some countries have a blank row. So this is because we have not been able to, it's not necessarily that there's no data available. It might just be that we haven't been able to identify it, or our country office hasn't shared with us, for instance. So it shouldn't be interpreted as meaning there's no data on this indicator for that country. It could be that there's data, but simply we haven't been able to identify it, or we haven't become aware of it. So again, we don't publish country level estimates if they're missing or we don't have them. However, We do account for countries with missing data as part of the calculations that we do for the global and the regional estimates. So in essence, the way that the formula works is that the regional rates that get calculated based on the available data that we have, those regional rates get applied to countries within the region that do not have data for the purposes of coming up with a global and then a regional estimate. So the countries are accounted for, and there's sort of an assumption. And the assumption is that the regional rate applies to those countries. But again, we don't publish that as being the country level figure because we know that, for instance, that regional rate could be higher or lower than the actual number in the country. So it's only used as sort of an underlying assumption, again, for the calculation of the global and regional estimates. So now let's take a look at the data availability in terms of what we have in the global database. And I apologize, I see there's a typo in this screen. So that middle column should be the number of countries with data on children in residential care, not in detention. We had the one on detention yesterday. So this is the number of countries that have data on children in residential care. So you have here the regions, and this again is according to UNICEF's regional classification. We have, as part of our global reporting, we include 202 countries as part of the UNICEF global classification. We have 125 countries in the world, in the UNICEF world, with a data point on children in residential care that are included as part of our global database. And this reflects 77% in terms of population coverage. So the available data that we have reflects 77% of the global population of children under the age of 18. And again, the year range that we have is data points that fall between 2010 and 2021. So you can see here we have really good population coverage for some regions, like for instance, Eastern Europe and Central Asia and Latin America and the Caribbean. We have 100% population coverage. So the data that we have in our database, the country data, reflects 100% of the regional population in those two regions. And then we have a population coverage above 90% in North America and East Asia and the Pacific, and then, lower levels in some of the other regions, but still above that 50% threshold that we set for publishing a regional estimate. Now, there are two regions highlighted there in red for which the population coverage was below 50%, and we therefore have not published a regional estimate for Western Europe or for West and Central Africa. So now let's take a look at the figures, the moment everyone's been waiting for. So according to our current estimates, based on the data that we have, there is just under 3 million children estimated to be living in residential care worldwide. So about 2.9 million, so just under the 3 million mark. And this is corresponds to a rate of about 123 children in residential care per 100,000. So you can see here that Eastern Europe and Central Asia is the region that has by far the highest rate of children in residential care, with 585 children in residential care per 100,000, and roughly around 620,000 children to be estimated to be living in residential care in that region alone. Now, even though Eastern Europe and Central Asia is the region that has the highest rate of children in residential care, it's actually not the region with the largest number of estimated children in residential care. And that belongs to East Asia and the Pacific, which of course you can imagine, because this region includes China, that's a big factor in why the number is larger in the case of this region. So in East Asia and the Pacific, there's estimated to be, almost 720,000 children to be living in residential care, and the rate is 131 children in residential care per 100,000. Now, again, as I mentioned in the previous slide, there were 2 regions that did not reach our threshold of 50% for the population coverage. So you will not see here, when you will not find it in the database, regional estimates for Western Europe and West and Central Africa. Now let's take a look at the 10 countries in the world that have the largest rates of children in residential care. And as you can see here, it's spread across a number of different regions. So we have countries in Europe, we have countries in Latin America and the Caribbean, and we have some countries in Asia. So here, the country in the world, at least among the data that we have available in the database that has the highest rate of children in residential care in the world is Russia. And then that's followed by Bhutan, Morocco, etc. Now, one important thing to mention here is that, and across the board in terms of these data, is that because we are relying on administrative records, we really rely on the quality of those records, and the figures that we have for the number of children in residential care is really reflective of the quality of the functioning of the administrative data system to produce routine, updated, and complete figures. So it's important to understand and interpret the country figures, but also the global and regional estimates in light of that caveat, because again, we're relying on these administrative records. So the records are only as strong, and the quality of those records is only as good as the underlying system, which is producing the records. So sometimes a country could have, a very large number, for instance, of children in residential care, or for instance, a very large rate, in this case, of children in residential care. But it needs to be understood in light of that country's system. So for instance, a country could have a very strong administrative data system when it comes to alternative care. And so they're able to produce figures that are very recent and very complete and of high quality. And so the reporting of those figures, it might just be of better quality than, say, another country whose system is much less mature or more weak in a sense. And so the number itself of children in residential care in each country, and also then the corresponding rates, kind of have to be understood and put in the context of a country's administrative data system and how well it's functioning. And this also brings us to the point of a caution that we have about comparing these new global and regional estimates that we've produced with those that have been previously published. So in 2017, we did put out, as UNICEF, an academic article in which we had estimated the number of children that were living in formal alternative care, including the number of children living in residential care. And that was the first time in many, many years that UNICEF had been part of a publication on with these types of estimates. However, we don't advise that the estimates that were in that paper that was published again in 2017, so now it's in any case quite outdated, be compared with these new estimates. And the reasons why we caution against making those types of comparisons, it can be for a variety of reasons that are not necessarily related to an actual change in the size of the population of children in residential care. So just a moment ago, I was mentioning how a country's administrative system and how well it's functioning and how mature it is can really impact the quality of the records and therefore the reported number of children in residential care. So for instance, there could be a country where they make a lot of efforts and there's a lot of investment to, say, strengthen the data system and improve reporting of, the number of children in residential care. So for instance, you could see a large fluctuation, even at country level, in the numbers of children in residential care over time, even year over year. And that could reflect more changes in the functioning of the system and the ability of the system to produce these numbers, rather than an actual fluctuation in the number of children in residential care. So that's a really important point, and it applies at the country level, but it also applies when interpreting the global and regional estimates. So it shouldn't be understood that, this latest global estimate that we have of nearly 3 million means that there's more children, for instance, in residential care worldwide today than there was when we produced the estimates in 2017, which those estimates were slightly lower. It was about 2.7 million. But again, we shouldn't interpret this as meaning that there's more children in residential care worldwide today. It might just be a reflection of the fact that the systems that we rely on to produce these figures are maybe getting stronger in some countries. Again, not reflecting an actual change in the size of the population of children. Some other factors that can influence the numbers is different at the global and regional level with those estimates is differences in population coverage over time. So because we do apply this more restricted year range when we calculate the global and regional estimates, we only, again, take into account countries that have a data point in these latest ones, between 2010 and 2021. So that means that, some countries who have a data point prior to 2010 that might have been included in the previous round of estimates that we produced are now no longer being factored into this latest set of estimates because the latest data point they have falls outside that year range that we're applying. So we can have countries, every time we sort of update these estimates and produce these new estimates, we inevitably have some countries that for which maybe we haven't been able to identify a more recent data point. We inevitably will have some countries that get excluded from the estimates and some new countries that might come into the estimates. So there can be some changes in the numbers that are also reflecting that. And then, of course, because we're using population figures to calculate the rates of children in residential care, these figures can also be, to a certain extent, influenced by population, by the population dynamics in a country. So if a country, has, for instance, larger population growth or things like that, that can also affect the rates that get calculated. So now we just want to talk a little bit about how are we, trying to work with countries and build the capacity of countries to strengthen their administrative records so that we can improve the quality and the availability of data on children in residential care. So one of the main things that we've been working on, and we sort of have a number of different tools that we've been working on in this area of alternative care, but the one that's specific to really helping countries to strengthen the administrative data system for alternative care is a toolkit that we've developed, which is meant to assess the current effectiveness and the current functioning of a country's administrative data system on alternative care and adoption, and really help countries to identify where targeted investments are needed to improve performance of the system. So this is a toolkit. It's a set of documents that all kind of work together. We have an introductory document that includes, the rationale, the methodology for the toolkit, a set of instructions about how to implement the toolkit, and then the actual assessment that a country undertakes has two components. There's a sectoral level questionnaire and there's a national level questionnaire. So the sectoral questionnaire is meant to be completed by the different sectors in the country that are involved in either the collection, the coalition, the analysis, or the use of administrative data on children in alternative care. So for instance, you might have 5 different sectors, for instance, in a country that are all involved in using and producing administrative data, and they would all individually complete this sectoral questionnaire. Then there's also a national level questionnaire, which is an attempt to sort of bring together all of these stakeholders to jointly complete an assessment of the administrative data system from the national perspective. And the content of these 2 questionnaires is really trying to understand and assess the different components of the administrative data system, from governance to data transmission to quality assurance procedures. So it's really a self-assessment that the country does on their current administrative data system, how it's functioning, how it looks like, with the end goal of then being able to understand, where are their bottlenecks, where are the barriers, and where do they need to really target investment and prioritize in order to improve the system. And one of the reasons why we separate it as sort of sectoral questionnaires and a national questionnaire is so that a country can, pinpoint and be able to understand if there's, say, one particular sector that maybe needs more intervention, it needs more investment to strengthen the way that they produce the data. And then within the different components that we assess as part of the questionnaires, you can also then further pinpoint, what particular area needs strengthening. So maybe a country sees that they're very strong and they have a very mature system when it comes to, for instance, legislation or governance, but they are more weak and less mature when it comes to coordination of the data system. And that's where they really need to target their investments and need to for improvement. As part of this assessment, we also include a core set of recommended indicators. So there's a set of 24 indicators that are sort of being recommended as the minimum set of indicators that a country should ideally be able to routinely report on when it comes to alternative care. So some of these indicators are things like, for instance, simply the number of children in residential care. So what we're talking about today, or the number of residential care institutions in a country. But it covers the broader scope of alternative care. So there are also indicators about, for instance, family-based care. There are indicators pertaining to adoption. There are indicators pertaining to more like case management of the children. So the assessment is also a way for a country to determine to what extent they're able to produce and report data on this minimum core set. And for every indicator that we've included as part of this set, there's also an accompanying metadata sheet to explain more details about the indicator. And I want to mention too that these indicators have been drawn on existing indicator sets that have been produced by many partners, like for instance, the Better Care Network, or for instance, UNICEF's own regional office in Europe and Central Asia. So we've tried as much as possible to draw on existing indicator sets to avoid, duplication, and most of the indicators that are part of that recommended minimum core set appear in these other existing lists and sets of indicators that have been proposed either by other organizations or even by UNICEF, but at different regional levels. We also include, as part of the toolkit, a workshop implementation guidance note. So this is really a step-by-step guide about how to undertake a workshop and plan for a workshop to bring together the national partners to complete the national questionnaire. So it's guidance on how to go about doing that. And then the idea is that once a country has done the self-assessment, so they've completed the sectoral questionnaires, they've completed the national level questionnaire, they use that insight that they've gained from completing the self-assessment to sort of map themselves against a data maturity model that we've developed. And this basically outlines and lays out different stages of maturity for an administrative data system. So ranging from, a system that is, more weak and less mature to a system that's, very mature and well functioning. And the idea is that a country can use the insights that they get from doing the self-assessment to then place themselves within that maturity model and see where they fall on that continuum across these different components that are part of the assessment. And then the next step after that, and which is the sort of ideal, the prospective step that we hope countries will then undertake, is to use the information that they've gained to develop a data action plan. So this data action plan should really outline concrete strategies and actions that the government and partners and other stakeholders will take to address the gaps, to address the challenges within the administrative data system. And we have a template that we've developed, that we will be developing for this data action plan, that can help guide countries in understanding what are the different components they need to include as part of this data action plan. So then finally, we also have some tools that we've developed. Apart from strengthening administrative records, we acknowledge that sometimes countries do need to undertake data collection to be able to generate a number of children in residential care. And we have developed a protocol and a set of accompanying tools that's really a comprehensive package for helping countries to collect data on children in residential care. So in situations, for instance, where there are maybe no administrative records, or maybe the administrative records are very outdated or weak and they need to be updated, we've developed some tools to help countries fill those gaps, or to be able to generate to collect data on children in residential care, so they can have a number of children in residential care. And the data collection protocol that we've developed, there's two phases of data collection. The first phase of the data collection is really a census of the residential care facilities in a country, and then a thorough enumeration, so a count of all of the children living in those facilities. So it can really be seen as like a census of the residential care institutions, as well as a census of the children, the population of children living in residential care. And a country could decide to stop there, and that could be sufficient for their purposes if they just, for instance, need to have this number of children in residential care. But they can also then, we've developed something that they can take it one step further, is that if they are interested in understanding maybe some more general well-being characteristics and how children are faring in residential care, we've developed a survey which is is based on a representative sample of children living in residential care, and it's a follow-up survey. So they use the information from the census to then draw a sample of children living in residential care, and they return back to those residential care facilities and undertake a number of interviews with the caregivers of the children, with, for instance, the directors of the facilities, and also do some direct hands-on learning assessments and things with the children to understand how they're doing across a variety of areas, from health to nutrition to education to protection to case management, etc. So it's a very comprehensive follow-up survey. And again, the protocol that we've developed, it outlines the recommended steps that a country can take to undertake these two phases of the data collection. It's accompanied by a suite of data collection tools, so all of the relevant questionnaires and everything that a country would need. And it's also accompanied by an implementation package that has a number of different tools and materials that would be needed. For instance, the interviewer guidelines, training materials for the interviewers, the tabulation plans when they have the results and they need to analyze the findings. So it's a really complete package that countries can use to undertake this data collection. And it is available on our website. The link is there. You can see it on the screen. I can also put it later in the chat as well. You can find it there. We've translated some of the materials as well into French and Spanish. So some of the materials are available also in other languages. And it's just important to mention that, this effort is not meant to, for instance, replace administrative records, but it's really can help a country fill that gap if they, for instance, don't have any existing administrative records on children in residential care, or they need to, for instance, go and update their existing records, or begin to be able to build a registry or a database of facilities in the country and children in the country that then can be used as a starting point for building those administrative records. We've also developed a protocol for doing some qualitative data collection as well, with families and parents of children who are currently living in residential care, to try to understand a little bit more the drivers and the reasons behind family separation and the reasons behind children's placement in residential care. So we're currently working to finalize that protocol, which will be very similar in the sense that it will be a document that outlines the steps that need to be undertaken to do the data collection, and it will be accompanied by the interview guides and the training materials. So that will be coming up in 2023 for countries to use as well. So I'm going to stop there because I've talked a lot, and I would like to now give the floor to my colleague Annie to give us some closing remarks and talk a little bit about some of the programmatic implications of this data work for children in alternative care, and then we'll open the floor for some quick questions. So over to you, Annie.
Thank you so much, Nicole. I hope you can hear me and see me as well.
Yes, we can.
Okay, great. Thank you so much. No, I wanted to start off by, and I'm going to speak for only a couple of minutes because I see quite a few questions there, which I think will be interesting for us to respond to. But I wanted to highlight that from a programmatic point of view in UNICEF, we have clear priorities as far as alternative care or care reform as a sector is concerned. And that is, number one is prevention of family separation. The second important priority is, when it is necessary, it should be family-based alternative care. And the third priority for us is ending institutionalization of children. Something interesting that I note, I would like to note is that in UNICEF, we do consider any type of alternative care that is not in a family, in a community, as residential care. For example, small group home care is residential care as far as UNICEF is concerned. And I'm glad to note that for this database too, we considered the same definition. However, Nicole, as you mentioned in the caveat right in the beginning, that sometimes the definitions may differ, and at the national level, in a country, they may count small group homes as family-based care, and therefore they may not have included number of children in small group homes as part of their national databases for number of children in residential care. And that would kind of give us not a very clear picture or full picture. I think the second point that is also equally important for us to consider is, and I think that has also come in some of the questions that I was just looking at, was other settings and where children are in alternative care, where children are in residential alternative care, but they haven't necessarily come through the competent authorities or through the administrative orders, for example, in boarding schools. And in some countries, the database may include those children. In some countries, they may not include those children. And that, again, will probably not help us because it won't give us a full picture. But having said that, I really want to highlight the fact that there are children who come in alternative care and who are continue to be placed primarily in residential care through competent authorities and through administrative orders. And the governments play an important role in establishing those mechanisms. Even if they don't run those alternative care facilities, the competent authorities are coordinated through legislation, and it's really important that the information that we get, even if it is a small subset of children in alternative care or the residential care, sorry, which we are looking at as the rate of children, I think it is going to be important for governments to have this information at hand, because that is really going to help them drive their deinstitutionalization strategies and plans. Because once you have a good sense of what is it that we are talking about in terms of number of children and then subsequently the rate of children that's going to help them rethink their investments and their budgets in that entire alternative care portfolio. And that will in many ways help realize how expensive it is also to invest in residential care facilities. So it may also serve that purpose. Plus, I think it will be important for governments to have this information at hand to prepare prevention plans, because very often our plans relating to alternative care are so focused on deinstitutionalization strategies and deinstitutionalization plans that the tap is always open. So the children continue to come into alternative care, and then you have to remove them from institutional care or residential care and put them back in family-based alternative care or integrate them back into families. But it's going to be important to use this information to also create prevention plans, which are evidence-based, which are well informed by what's there on the ground. And similarly, I think it will be equally important to use this information to have solid plans for promoting family-based alternative care, because, as part of deinstitutionalization efforts, very often we have seen that big institutions are becoming small institutions, or children are moved from big residential care facilities into small residential care facilities like small group homes, and that needs to change. And for that to happen, I think it will be also important for us to have this awareness of the information as to how many children are we really talking about that need to be integrated back in families and placed in family-based care. But I see we literally have 4 more minutes left, and I see 9 questions there. So I'm sorry I took longer than I should have, but back to you, Nicole.
Thank you so much, Annie. I know I see many questions, so I will we'll do our best to try to get through as many as we can. So I've put in the chat box the link to our website, the thematic page on children and alternative care, where you can find these latest global and regional estimates. You can find the database. And if you scroll down, you'll also see an area where there's additional resources, and you can access the information about the data collection protocol that I was mentioning. So the protocol for the census and the survey on children in residential care. There's a dedicated page that you can link to there for that as well. In terms of the toolkit, I saw someone was asking, it's not currently available. We're still in the process of finalizing the materials, and we're going to be doing some testing and some implementation in countries to further sort of test the methodology and sort of fine tune things before we make it publicly available. But we do anticipate that it will be made available probably sometime in the later half of next year. And when it does become available, we'll also get uploaded on that website that I've linked to in the chat. I saw there was also a question about the availability of the protocol for the qualitative data collection I was mentioning. That one also is still being finalized, but we do expect that it will be made available probably in the later half of 2023 as well. And when it's available, it will be also uploaded to that webpage that's linked in the chat. There's also a number of questions that I'm going to kind of group together that we're asking about disaggregating of the available data. So are we able to, for instance, disaggregate the figures by different types of care settings? Can we disaggregate by understand the number of children in small scale homes versus like a large scale institution? Being able to disaggregate is really important, but unfortunately, even just being able to get these numbers of children in residential care is extremely challenging. Even as simple of a disaggregation as sex of the child is really difficult and is not always readily available for all of the countries, which is why you'll see in the database, we actually don't even have any levels of disaggregation. It's because simply for most countries, they're not able to accurately disaggregate their figures, even by something, again, as simple and straightforward as sex of the children. We get conflicting numbers. We get a number of boys and girls that doesn't equal to the total. So there, and this is, again, is reflective really of the system and the many challenges around producing, quality records of for children that are living in residential care. So unfortunately, for the time being, the database, the publicly available database only has the total figures, and we don't have these additional types of disaggregation, which we would love to have, and are really important to be able to, inform us for our efforts, but simply just not available in most countries, or the quality is questionable. I think there was also, I saw a question about, Florence was mentioning that, and I do want to acknowledge Florence. She's been instrumental and has been supporting us as a consultant in the area of the strengthening administrative data systems, and has been also working with us on the development of the toolkit. So I do acknowledge her contribution. She was mentioning that, or she was commenting that the figure of the global figure for the just under 3 million children that are in residential care, it's based on the administrative data. That's correct. So again, in most countries, we rely on the administrative records. So of course, yes, she's correct in saying that this is probably just the tip of the iceberg, and this figure should be interpreted as probably being an underestimate of the actual true number of children that are living in residential care settings worldwide. So again, the figures can be seen as being probably, again, just sort of the tip of the iceberg. You can take, as I said, some people were asking about country level figures for North America and Western Europe. You'll be able to find those in the database. So for countries for which we have a data point, for countries in those regions, you can go and take a look at the database to find the individual country level figures that we have available to us. Someone was also asking about where the data collection tools have been used or are planning to be used. So in the case of the census and the follow-up survey on children in residential care, we implemented the full census and the follow-up survey at scale at national level in Ghana in 2019, and we actually have a report with the findings from that exercise that, again, can be found on the link that I've put in the chat. So Ghana, to date, Ghana is the only country that has implemented that census and follow-up survey on children in residential care at national level, but we've also replicated it in a smaller scale at subnational level, and in particular regions of a country in places like India, in Kazakhstan, most recently in Uzbekistan. The next country that's exploring the possibility of probably implementing that census and survey at national level is Vietnam, and we're currently working with them on that. And I'll just try to get through. I think there's 2 more questions. So someone was asking how we evaluate the quality of the data. So I did mention that we have a sort of as part of the CRAVE mechanism that we use for updating our global databases with our network of country offices, we do have that predefined, preset criteria against which we evaluate the new data points. Now, in terms of whether or not we can assess quality of the data, that's really difficult, again, because these are administrative records. So there's no real mechanism or way for us to be able to assess sort of the quality of the data. We assess that, for instance, it's coming from an official source, that we can understand the types of residential care facilities that are reflected. So in terms of the count that a country provides us, we do want to understand the definition. So we do ask them to give us, this is children in residential care, what types of settings are covered by that definition. But definitely being able to assess quality of the data is really difficult in this case when we're relying on administrative records. And of course, we understand that there can be varying levels of quality across countries in the reported figures that we include as part of the database. And then I think the last question that I'll try to quickly address, because I know we're already over time, is someone was asking, is there any reporting on the number of alternative care institutions in a given country? Okay, so we currently, as part of the database, we only have country level figures for the number of children in residential care settings. But as part of that recommended core set of indicators that we're putting forward as a minimum core set that a country ideally should be able to report on through their administrative records, this is one of the indicators. So ideally, a country should, of course, be able to know the number of residential care institutions across the country and be able to sort of routinely report on that number and understand that number. And it is something that we, again, include as part of that recommended core minimum set. And it is a number that can be produced through doing the data collection. So if a country implements phase 1 and does that census of residential care institutions, that also would allow them to come up with the number of residential care institutions in the country. Okay, I think I got through them all. So I really want to thank you for participating in the webinar today. It was our great pleasure to be able to present this to you. And I also thank my colleagues Claudia and Annie for their remarks as well. And I also just wanted to take a moment to acknowledge, the amazing work of our country office colleagues who we work with very closely to be able to identify these data points. Without them, it would not be possible to have this global database. And I also want to acknowledge our other colleague Badar, who is a part of our team at headquarters, who helps us with the CRAVE exercise and with database maintenance and updating. And he's also been absolutely instrumental in building this global database. And so I wanted to acknowledge him as well. And thank you very much. We will be sending a follow-up outreach message with links to the presentation, as well as links to the recordings of the webinar. And we'll include also, again, the link to our website, which is, again, in the chat box there. You can find the resources that we discussed today. So with that, I would like to close the webinar and say thank you once again. Take care, best wishes. Thank you so much.